April is STI Awareness Month, and you might have heard STI, STD, and be confused about what those two terms mean, and really they mean the same thing. So STD stands for sexually transmitted disease, and STI stands for sexually transmitted infection. And those things really can be used interchangeably. There are 20 million new cases of STDs diagnosed in the US every year. So it's at an all-time high, and I think this is a time where it's really important for everyone to think about how to protect themselves, how to recognize signs, and how to get treated if they need that. The best thing you can do to protect yourself is not to have sex, but that's not a reality for a lot of people. So the most important thing you can do is to use condoms consistently, especially if you have a new partner or if you have a partner with whom you haven't discussed STD risk or STD history. It's also important to know, though, that condoms don't prevent 100% of STDs. So some cases of HPV, which is human papillomavirus, and also herpes may be acquired even if you use a condom every single time. The other thing I want people to know is that there's a vaccine for an STD. So the HPV vaccine is around. We're routinely vaccinating adolescents, but even young adults can get this. So up to age 26 for women, and for some groups of men, you can still get that vaccine. So if you haven't had the HPV vaccine and you're under 26, talk with your doctor and see if you're a candidate. Another thing that I think is really important to talk about is talking with your partner. So, sexual conversations about STIs or sexual history can sometimes feel uncomfortable to people, but it's really important to get comfortable talking about it, not only with your doctor, but with any new partners that you're gonna have. Talk about your history, talk about your risk, and really make informed decisions together about how you're gonna proceed in your relationship. The last thing I want people to know about is testing. So your doctor can test you at your yearly physical, but also anytime that you have a new partner or you have concerns that you may be showing symptoms of an STI, your doctor can always help talk through that with you and provide testing if medically necessary. It's also great to know that if you test positive for some STDs, including gonorrhea and chlamydia, you may actually be able to get treatment for your partner without them having to make a separate appointment. And that's something called expedited partner treatment. So if you test positive and you have a single sexual partner, it's great to ask the doctor if you may be able to get treatment for them as well. And that way you can avoid passing the infection back and forth to each other.